Paul's videos are really good, you guys. Um, he releases like one a day, I think, usually. But he's been covering a lot of the true crime cases. Um, and he has some interesting takes on this stuff. Um, I was not aware of this case, but it hits kind of close to home for me.
Y'all, you're going to need a box of tissues and some anger management classes after we talk about today's Netflix documentary, Take Care of Maya, because when I watched it, it had me in absolute tears and in absolute rage at what was done to her and her family. And we're going to talk about all of it in today's video. Hello, Sofa Squad, and welcome back to the sofa. The sofa's back there. Our little mascot Roscoe's back there, and you'll also probably notice a little something over him. Roscoe wanted a portrait too.
By the way, if you want to follow him, it's Reporting Live from My Sofa is the name of the channel.
Make him forever, and well, what Roscoe wants, Roscoe gets. And my name is Paul. Welcome to the channel, or well, welcome back to the sofa if you've been hanging out with us for a while. Now, y'all, today we are going to be reviewing the Netflix documentary Take Care of Maya. Now, here's the thing. This is currently in trial right now. And so what I wanted to do is this. I've talked to some of y'all about this like in comment sections and other parts of Instagram, stuff like that or whatever. So I wanted to like go over the trial and all that, but I wanted to start at the beginning with kind of an overview to get myself first and foremost on like a what exactly is this case and what's going on before I delve into the trial. So that being said, it's just heartbreaking to me, and it's so utterly important that she was finally able to get to trial, and that this is going on right now, because in my opinion at least, this family was wronged on such a major level. It's just absolutely gut-wrenching. So the way we're going to do this is we're going to be reviewing the Netflix documentary. Again, it's called Take Care of Maya. We're also going to be reviewing an article. When we get to that point, I'll put it up there, let you see the, cover of it and all that. So there's that. We'll do all that, and just kind of talk about it, do opinions. We'll do the majority of opinions at the end of it. But you know me, if you've been watching, well, good Lord, I have to spread them throughout. Now, look, before we even jump in, if you do want to follow me on the old Insta, on the old gram, if you will, go on, click the link. It's in the description, whatever you kids call it, and it's on the screen here, whatever. Roscoe makes appearances over there. He keeps it worth watching for, okay? So, that being said, what I want to start the video off with is, let's just go over some basics. Like, this is this person, and this is what this term means that we're going to hear a lot of throughout this. Okay, so just starting with the family here. The mother, Beata Kowalski, now she came over from Poland when she was 16 years old. She put herself through college. She ended up being a nurse, a very strong woman. Keep in mind as we watch this about her being the nurse and having just that kind of knowledge and that background there. Now, the father's name, so Beata's husband, Maya's dad, is Jack. And then she also has a brother. And then Maya, of course. Maya is I'm going to say one of the victims in this, right? She's the central one, victimized by the hospital. But in my opinion, the entire family are victims, right? But obviously, Maya, was essentially medically kidnapped by the hospital. Okay, so there's those players, key players. Now, let's just talk about a couple of names that are going to be prevalent that I want you to really think of and know of as we go. So we have Dr. Anthony Kirkpatrick. Now, he's the one who diagnosed Maya with CRPS. Don't worry, we'll figure out CRPS in a minute.
CRPS is complex regional pain syndrome. I have also been diagnosed with this after I was bit by the attack dog. And what he's going to read for you the Wikipedia definition of it, but basically what it means is that you have irreversible nerve damage, and all you can do is treat the pain, and you're never going to fully recover, right? Because you've received some sort of traumatic experience. In my case, it was blunt force trauma. Or it could be from a surgery. It could be from a heart attack. It could be from a stroke. Like I said, in my case, it was blunt force trauma. it sounds like, as he goes on, that if indeed it's a correct diagnosis for her, um, it happened out of some sort of abuse.
And he turns them onto the ketamine treatments. Don't worry, we'll figure out the ketamine. Good Lord, hold on now. Okay, so that's him. Now this is where y'all go on. Roscoe, get us signed up for anger management. It literally gets me going just saying the name. Dr. Sally Smith. Woo, Mama Jama. Okay, let's put a little thing up here on the screen and just read this article that kind of describes who she was very quickly. So as you see, it says, who is Dr. Sally Smith? Dr. Sally Smith is the former medical director for the Pinellas County Child Protective Services team in Florida who came under fire after investigations revealed that her quick methods of diagnosing child abuse led to dozens of instances where charges were dropped, parents were acquitted, or caregivers were found to be credibly innocent. Okay, so just keep that in your mind as we go. Now let's look up a couple of definitions just to know before we get into it all, because you'll hear them over and over. Okay, so first let's look up what is CRPS. Disease. Complex regional pain syndrome. So it says chronic arm or leg pain developing after injury, surgery, stroke, or heart attack. The exact cause of the complex regional pain syndrome isn't well understood, but may involve abnormal inflammation or nerve dysfunction. Now this little thing right beneath it, it says rare treatment can help, but this condition can't be cured, requires a medical diagnosis, chronic can last for years, or be lifelong. Okay, so there's that. So that's at the center of this. This is what she would be diagnosed with, okay? So now, well, let's look up ketamine. Okay, so what is ketamine? So ketamine, medication. Ketamine is a dissociative anesthetic used medically for induction and maintenance of anesthesia. It is also used as a treatment for depression, a pain management tool, and as a, well, recreational drug. So there's those two things, so you know that going into it.
I was not prescribed anything like that. I was prescribed some pretty serious anti-inflammatories that had some severe side effects of suicidal thoughts, and so I chose not to take them and just to just to learn how to live with the pain.
Because you'll hear them over and over. Okay, now that we've got the palette done, now that we've built the foundation, let's get into it. Okay, so it's 2015, and Maya begins this whole process, her symptoms, and the symptoms come up, it's like pain, tiredness, and it started with a breathing problem with a respiratory infection. Her skin was hot, her feet began to turn inward.
I remember I was in a great deal of pain. My arms, my legs, my feet. I would always feel very lethargic, and I wasn't able to move as efficiently anymore.
Now, here's the thing. There was literally no answers for them, okay? They went from doctor to doctor, hospital to hospital, nothing, right? Now, remember, the mother, Beata, she was a nurse, so she's documenting every last bit of this. Now, keep that in mind.
Interesting, though, because my feet have been curling in, and I've also been very lethargic.
Because her due diligence with that is part of the reason why they're going to hopefully be able to get justice. Now, I want to go ahead and introduce the article that we're also going to be referencing. So let's go ahead and check that out on the screen, and I'll read through it. You can pause to read or go through it with me. Okay, so you see here on the screen, this is by The Cut, and it's by Diane Nere, and it says, what happened to Maya when a 10-year-old girl complained of mysterious pain? A doctor suspected child abuse. How far would she go to prove it? And there's a wonderful picture of Maya there. Now let's move on to the first little clip that we're going to be reading. So it says Beata Kowalski could pinpoint when it all started. The 4th of July weekend, 2015. Maya and her younger brother Kyle were playing with sparklers near their home in Venice, Florida, when she had a severe asthma attack. Beata took Maya to Sarasota Memorial Hospital, where she began to complain of a burning sensation in her legs and feet. And within weeks, she could barely walk. Her feet turned inward. She developed lesions, and her legs could no longer support her body. At night, Beata could hear Maya's cries from her bedroom on the other side of the house. She worked as a home care nurse and had seen many kinds of suffering, but Maya's symptoms were like nothing she had ever encountered. Now, eventually, this is when they would find Dr. Anthony Kirkpatrick, who would give her the diagnosis of CRPS.
It was clear and simple: CRPS, complex regional pain syndrome.
Now, the symptoms and whatnot that she seems to be exhibiting are literally like all in line with this. this, right? The doctor is like, oh, bam, clear case of this. Here's what we're doing. But this is the thing. At this time, and as you even heard in the little definition that we did, it's very rare. It was relatively new back then. So this was not something that a lot of people were like, oh, yeah, we know what this is. And, a very commonly known thing in the medical world.
This syndrome was first described over 100 years ago, but it was only recognized in modern medicine in the 1990s.
Now, this is where things will take a turn. So it's like, okay, we have, this diagnosis, but then treatment for this is like, it's not really that easy to treat. And this is where things will lead them to the alternative therapies, and the alternative therapy being named ketamine.
Wow. We've treated over 3,000 patients with complex regional pain syndrome. And we know what the best therapy is for it. It's called ketamine.
Okay, so now let's very quickly go look at the DEA.
That was never mentioned to me at all, and I'm glad, because it sounds like this is a nightmare story. But the type of treatments that I've been recommended to are acupuncture, which actually made it worse for me. I don't know if I'm allergic to the needles or if it just like triggered my nerves or what. But acupuncture did not work. I've been into physical therapy several times. I'm currently in physical therapy right now. I have future testing coming up for like an MRI and some nerve testing. That's the type of stuff that you're supposed to do for complex regional pain syndrome. I'm shocked that they would put a young person on such strong drugs. That's amazing to me. Rather than just have her reevaluate her asthma situation with, I guess that'd be like an ear, nose, throat doctor, right? And send her to physical therapy.
Page as to like their definition, like what they're saying about ketamine. So here you see on the thing, it says ketamine, you see the little pictured vials of it. It says ketamine is a dissociative anesthetic that has some hallucinogenic effects. It distorts the perception of sight and sound and makes the user feel disconnected and out of control. It is referred to as a dissociative anesthetic hallucinogen because it makes patients feel detached from their pain and environment. It says it can induce a state of sedation, feeling calm and relaxed, immobility, relief from pain, and amnesia, no memory of events while under the influence of the drug, and is abused for the dissociative sensations and hallucinogenic effects. Ketamine has also been used to facilitate SA. Ketamine is an approved medical product as an injectable, short-acting anesthetic for use in humans and animals, and as esketamine, something, the active form of the drug, as a nasal spray for treatment-resistant depression. Now, here's the thing. Ketamine, this and nowadays, or whatever at least, is way more widely used. However, what we'll also learn is that in order to get the type of results that they needed for Maya at this level of pain, they would have to do major amounts of it.
Olivia and Mitch now share a space.
Oh, I see.
Ketamine is a safe, effective treatment for advanced complex regional pain syndrome. Because when the ketamine gets into your body, it actually stimulates the brain and kind of resets everything.
Now, this would prove to work for Maya, but like I just said, it was one of these things where she was only able to get low dosages and things of that nature here, and so they needed to do these mega treatments. There was another form of this treatment, but it would take them all the way to Mexico. Now, they would have to pay out of pockets for these, and it was doing this a large amount where essentially they're putting a patient in a coma, and they're doing like this large amount of it too.
What the fuck even? Oh my God, I would have never approved that for my child. And her mom's a doctor or a nurse or something? Oh my God. The minute you're saying, well, we got to go to Mexico. Oh my God. No, we don't. This is crazy. This is like Michael Jackson style of medicine.
Do these treatments. And so this is the avenue that they would have to pursue.
And it works.
Dr. Kirkpatrick says the experimental treatment is only available in Mexico.
So So the risks are really high, but there's not really any other option for the family. They're watching their daughter deteriorate every day. She gets worse and worse and worse. So they end up deciding they go to this trip. They go to Mexico. Monterrey, Mexico is where it's at for the procedure. Now, this is November of 2015. Now, Maya would say years later in depositions that yes, the dosages she took, she did remember some of these side effects that they talk about of hallucinations and whatnot, but that absolutely 100% that these treatments worked, they helped. I mean, it was life-changing at this time.
Okay, Maya, it's now January 6th, and you had...
I had to get sympathetic blocks, which were shots in my spine. I don't know what they injected. So if they injected ketamine, I'm unaware of it. I have no idea what they put in my spine, but in the cases where I had sympathetic blocks, it only lasted for about 2 weeks. I got pain relief for about 2 weeks.
Your ketamine coma. Now, having been through all that, was it worth it?
Yes.
Doesn't she just seem so much happier? I mean, like, the smile on her face, she just looks so refreshed, right? So now, once the family gets back, and this is kind of like an obvious, how healthcare and the cost of it are here in the States, they're paying 10 grand a pop for these treatments, and like, we can't afford this, right? So Dr. Kirkpatrick's like, hey, look, I got you. I have a colleague over here, Dr. Hanna, who, he'll take your insurance. We can do low dosages, almost like a maintenance type thing. So they end up getting introduced to this doctor and continuing forth. Okay, so let's reference back to the article real quick and go over a few things in that. So it says, over the next year, the Kowalskis took Maya for ketamine infusions every 3 to 4 weeks. Kirkpatrick charged him $10,000 per 4-day session, which was not covered by health insurance. Beata worked extra shifts, and the Kowalskis sold a rental property to cover the cost, and eventually they shifted Maya's treatment to a second specialist, Dr. Hanna of the Florida Spine Institute, whose rates were lower. Maya still required a wheelchair, but the ketamine led to huge progress, Jack says. Maya's feet straightened, the lesions healed, and there were periods when her distress seemed manageable. So things went really well for a while. Like they said, her feet straightened. There's this noticeable improvement of what she was doing. Quality of life seemed to really change for her with these ketamine treatments. But then, as we make our way to October 2016, things start to go down south very quickly for her. So Maya is in like extreme pain. Now Jack, the husband, the father, is at home with her, and the mother, Beata, is out. I can't remember where she's at, but she's either at work or something. But he calls her and it's like, oh my, like, what do we do? What do we do? And they make this decision, as any parent would, like, we need to take her to the hospital. And so they are going to be in for a rude awakening when they take her to the hospital.
The first nurse in triage had no idea what CRPS was.
Now, you can only imagine to their dismay, like, oh my gosh, they...
Yeah, this is true. This is true. Apparently, a lot of medical professionals have never even heard of it before. And even when I went to get my handicap placard at the DMV couldn't recognize what that was and didn't trust that my doctor was real. And I was like, look, this is my second placard. Come on, y'all. So I had to talk to my doctor, make him spell it out, explain what it was. And that caused hostility between me and my doctor. Because a lot of people don't know what the hell it is.
We know what this is, right? They've already been through the ringer with us, going from place to place to place to place and doing these treatments. But again, as you heard, this is like a lifelong thing. It can come up like that. And so their kid, is in major distress. Of course, they're going to go to the hospital. So, Jack's like, let me get my wife on the phone so she can explain this. And that's what they do. They put her on the phone to try and explain what's going on.
Her concern was merely administering ketamine over and over, more and more and more.
So the staff, who don't even know what the diagnosis is, right? Not at least some of them, and understandably, they're a little bit like, you're wanting to give her what? Like the ketamine. Like, remember, this was not like this widely accepted thing back then. And especially at the doses that they were saying that she was taking. So, this is a good place to kind of pause and talk about this dynamic, because there's two sides to this right here. There's the see something, say something scenario, right? So absolutely more power to that. Now, where this will take a left-hand turn is once that's done, once that's reported, and evidence starts to show, oh, wait a minute, this is what was really going on. The hospital staff and the hospital seem to just dig their heels in and make it an intention and to leave things out to prove a point that wasn't really there. So we'll talk about that more later, but I just want to kind of put that out there because, as I was watching this, I was like, look, I want people to report if there needs to be a report. If you follow true crime, then so many times people, authorities, people in places, they don't say anything, and then the unthinkable happens to a child, right? So I don't want to sit here and come off like I'm being like, oh, they shouldn't have done anything. Look, I get it. And even Jack will say at the end of the day, like, look, we get it. They want to prevent abuse going on. 100% we're behind that. They need to go about it a different way, though, in these instances where all this evidence has come up that this ain't working.
She was.
Yeah, but if they don't even understand what the disorder is, and they're mandatory reporters, that's a pretty messed up combination of events for a little girl who's suffering from asthma, had an attack so severe that it sent her into complex regional pain syndrome. But it can, according to the description of it, it can happen from medical events. It can happen from a traumatic event like what I experienced, a blunt force trauma, or it can happen from a stroke, it can happen from a heart attack, it can happen from a surgical procedure. So I'm not surprised that it could potentially happen from a severe asthma attack.
Belligerent, demanding. The mom was very controlling, and she told me, this is what you're going to do.
So here's the thing. So the staff and the mother are like butting heads, right? There's a vibe there that's not good. They don't want to be told what to do. I can almost see this playing out in my head. Now they're also sitting here like, if we gave your daughter this dosage of ketamine, she could die. And you'll hear them say, it's like, they don't, she doesn't seem to be fazed by this and that and the other. Remember, they've gone through this. This is not like it's normal to them, but they've been through this so much. It's almost like, look, we know we've done this, right? This is what has worked. This is what we need to have happen. And that wasn't happening. So understandably, both sides are very frustrated with this. Now, the doctors will sit there and be like, okay, we'll give her a low dosage of K, and it does nothing. And that begins to make the staff question, well, was this original diagnosis even true?
As the days progressed, we did not feel that we were making any effect to Maya's status. In fact, we began questioning the diagnosis of complex generalized pain syndrome.
Now, as you can imagine, as this is going on, they're going to understandably get to the point of saying, why are we here? We just need to leave. We just need to take our daughter and go home. However, the hospital ain't having that.
We were told if we plan on trying to leave, that security would be called.
And if you have a suspicion of child abuse, well, then you're required to contact Child Protection Services.
Okay, now let's quickly reference back to the article we've been reading through. We're going to jump down to about halfway through this paragraph and just read through that. It says hospital staff wanted Smith to complete her evaluation first. It's talking about Susan. And they told the Kowalskis that leaving the hospital would be AMA against medical advice. If the parents attempted to take Maya home, they said they would be arrested. Okay, now you can only imagine. So it's like, what do we do, right? Now, we're going to also learn that
What you do is transfer her to a different hospital. Because that's some bullshit. Right? You find a hospital that understands what the diagnosis is and knows how to treat it.
that's not necessarily true. Okay. And so that's another thing that's going to, it has come out in court depending on if you're watching it. But at this time, again, we're kind of in our minds transported back to this time where this is what they thought, right? So they're just like, okay, we're stuck here. We're not going anywhere. Our daughter's not getting the treatment. Like, I can feel their frustration. Now, on the same note, on the other hand, at this stage in time, when this is brand new to this hospital, they don't know anything. All they know is this family has come in. They're saying that A, B, and C, here's this is what we do, and to them this is alarming. They don't know enough, so I can understand having a concern of, we want to make sure that this child is not, being abused, like medically abused by the parents or whatever. Again, I'm not doubting the hospital for initially wanting to investigate, because so often, as we've seen, they don't, right? But I can also just see them.
Yeah, well, the big problem was that they went to Mexico for treatment. But every other situation they were in, they were under medical care for their daughter. So there could be no question over having licensed physicians taking care of their daughter. But the fact that they went down to Mexico for those treatments is that puts the whole thing in question, right?
The tension, I can only imagine what the parents must have felt like, knowing this is what works, it's worked before, and these people are refusing it. Okay, so now we need to buckle the seatbelts up. Roscoe, get them buckled back there. Because y'all, this is where we're going to meet Dr. Sally Smith, the woman who would turn this family's life upside down.
Do you solemnly swear or affirm that the testimony you're about to give in this case is the truth, the whole truth, and nothing but the truth?
I do. State your name for the record.
Sally Marie Smith.
Okay, let's go back to that article before we continue to get a little bit more like behind the scenes and whatnot of what was going on. So on the screen here, you'll see it says the nurse concerned by the demand for such a powerful drug asked a social worker named Deborah Hansen to meet with the Kowalskis. They were distressed, Hansen later recalled. There was a lot going on, and Maya was, she widened her eyes at the memory, captivating. Maya was also thrashing about. Hansen agreed that it was strange for Beata to demand pain medication before allowing a routine test. A parent being uncooperative or failing to heed a medical professional's suggestions is considered a red flag for neglect. And
let's also remember that her relapse into like serious pain happened a year later. So it's not like it could have been affected by the use of ketamine at that point, because it would have been totally out of her system. There is no way that you get ketamine injections a year before and then have a triggering event that sends you back into a pain cycle, which I know all about the pain cycles. Mine come much more frequently than that. I get them pretty much on a monthly basis, combined with my menstrual cycle, or depending on whether if it gets too hot or if it gets too cold.
and filed a formal notice with the state. By the next morning, Florida's Department of Children and Families had discarded her report for lack of evidence, but some at the hospital remained concerned about Maya's case, and a pediatric ICU physician named Beatriz Tepa Sanchez placed a Saturday afternoon phone call to Smith, seeking her expert opinion. Smith is a doctor with more than 30 years of experience in child abuse pediatrics. Virtually everyone at All Children's, maybe even most medical providers in Pinellas County, regarded her as the doyen of the field. I'm probably saying that wrong. She had spent so much time in the hospital that physicians knew to call her at the first indication of abuse or neglect, and they nearly always deferred to her judgment. Now, right away, side note, red flags immediately. We see this time and time again in these situations and cases and whatnot, where someone holds a lot of power and they've done something for a while and they don't need to be doing that, because it's almost like they bring their own bias, their own stuff into things, and such is the case with this. Now, also keep in mind, so, Sally Smith is entering the scene here. She doesn't work for the hospital, but she isn't very forthcoming about that with people. She kind of allows them to think this.
Oh,
She
no.
came in and she acted like a regular doctor that worked for the hospital.
Now, again, let's continue to get some more in-depth information from this article we've been referring to. So it says that All Children, Smith wore a badge bearing the hospital's logo, and during the pandemic, sometimes sported a white lab coat. Families often assumed that she was a doctor on staff and that what they told her was protected by doctor-patient confidentiality. In reality, she didn't work for All Children's, and her primary employer was not the state. Florida privatized its child welfare system in 2004, and the work in Pinellas County is outsourced to a company called Suncoast Center Incorporated. Smith was one of its 117 employees. Suncoast and similar entities across the state are funded by more than $3 billion of public money, yet there is little oversight of how effective they are in stopping child abuse, or of how often they allege wrongdoing where none exist. In Pinellas County, children are almost 2.5 times more likely to be removed from their families than the state average. Again, red flag central for this entire thing. Now, during this, she's going to question Maya about some things. She's going to question the father. Why would you let your daughter do this? They'll go over all of this type stuff. And later in depositions, Maya would say, look, if we knew who she really was, we would not have had this discussion with her at all, right? And so then at this point, the staff is trying to think, okay, we have a Munchausen's by proxy situation going on here. So let's just look it up real quick here, y'all. Let's go to WebMD. It says, is a psychological disorder marked by attention-seeking behavior by a caregiver through those who are in their care. So here you can see this could have had some flags of that and whatnot in the beginning.
Yeah, you could look at Eugenia Cooney's mom, who is helicopter parenting her right now, and needs to be around her at all times, right? That woman is monitoring her 29-year-old daughter who has anorexia, and we have to wonder, why? Why is your daughter anorexic? Why does she still live with you? Why are you putting her, you're a fat woman. Why are you putting her in a position where she's going to die like Karen Carpenter? Right? But I think that pretty much Eugenia, I'll get back to you, Stephen. I think Eugenia is the breadwinner. That's Deb's meal ticket, and she wants to monitor that situation at all times. I can't even imagine being 29 years old and not living on my own. I lived at home a little longer than normal because I was a young parent. I had my son at age 20, so I needed my mom's help, right? And I stayed at home until I was 26. But she wasn't following me around. She, in fact, did a lot of babysitting for me so that I could go out and enjoy times with my friends. That doesn't seem to be what Deb does. But yeah, there's some people out there that appear to have this particular condition.
Now, here's the thing. Sally Smith would talk to them for less than 10 minutes, right? And then this would determine this family's fate.
She did a 10-minute interview at most, and shortly after, she walks out.
Now, from this, she will say, yep, ample evidence of child abuse, and the mother is the primary one doing this. Now, soon after they come in, the father's in the middle of doing something. They're like, you gotta go. Your daughter is in state custody now. And you can imagine they're like, what? This is devastating for the family. Obviously, they contact a lawyer. Now, the lawyer, when interviewed for the documentary, is like, yes, you know what? The mother's very knowledgeable about Maya's condition. She could not understand, why this was happening to them. She could not wrap her mind around this, right? Now, the lawyer will explain, look, CPS, the power that they have, kind of break it down for the family to be like, this is what you're caught up in now. Now, this time she'll explain to the family, this is who Sally Smith is, right? This ain't your friend.
Children in Pinellas County are almost 2.5 times more likely to be removed from their families than the state average.
Now, we'll learn that Sally Smith prides herself on this. Now, one thing that was interesting in the documentary is they talked to her basically her opinion or whatever, on Beata, what's the vibe type thing. And she was like, look, at times she can be super direct, right? And she was like, and I think that some doctors probably found this offensive. And basically she was like, I think somebody there at that hospital was offended by her, that behavior, and her just being too direct. We're going to do this and kind of a thing. And to me, watching this, that was the vibe I got too. Like almost like this started off, the nucleus of it was, number one, you're coming in, this is out of the norm, right? Okay, here's this child with this, the parents saying this, the parents very direct, very demanding and all this, and it rubbed somebody the wrong way. And I'm not trying to say it was like a revenge thing, but they got it in their mind of, no, we don't believe this. This is what this is. And they wouldn't look any other direction.
So, what was your personal assessment of Beata?
I think she could be a little too direct sometimes, and maybe some of the doctors took that offensively.
Now, Dr. Kirkpatrick, remember,
Why was she allowed on the premises? Why was this Sally Smith allowed on the premises to misrepresent herself as an actual hospital employee? Why was this allowed to happen?
he's the one who gave this original diagnosis, right? Well, he hears about what's going on. And in his world, he's like, oh, whoa, wait, let me call her. Let me tell them what's going on. And so he says that he calls Dr. Sally Smith to be like, no, look, this is what's really going on here. You know, this is not a case of, child abuse or whatever.
This is what the diagnosis is. If you want to see the objective evidence, I got it for you. I told her that on the phone.
Now, let's refer back to the article to go a little bit deeper into that. That evening, Kirkpatrick sent a memo to a colleague. I cautioned Dr. Smith about accusing a family member of criminal conduct as she moves forward with her investigation, he wrote, noting that doing so could result in needless and permanent harm to the child and family. Separately, Hannah advised Smith that Munchausen by proxy was a common misdiagnosis in CRPS cases. According to the Cleveland Clinic, there are no reliable statistics on the disorder, but one estimate is that 0.04% of child abuse cases reported annually are related to it. The doctor's warnings were not included in Smith's report to the state, which urged that Maya be protected from her parents. Now, here's the thing. So, of course, like I just said, in the reports that Sally writes, she conveniently leaves this stuff out. And this is what I'm talking about earlier when I said, you see very quickly in this, evidence starts pointing away from like abuse, where it's like you've got documented stuff of doctors doing this and they're standing by this. If you've watched some of these other cases of Munchausen's and whatnot, and eventually like when some of these doctors start talking and comparing stories, and it's like, no, that's not going on here. But not only does Sally ignore that, she intentionally left it out of the reports to form her own narrative. And even in depositions, she is completely removed.
Is that how you would classify what happened to the Kowalskis? Distress?
I don't know. You'd have to ask them how they responded to the whole thing.
So now at this point, Maya is stuck in state custody, right? She's at the hospital. The parents, as you can imagine, this is very stressful. They each have different ways of how they feel like they should go about things.
Beata was focused on Maya's care.
If my daughter requests to speak with me, I want to be able to speak with her.
But my approach was not to cause any more tension between the hospital and our family.
Now, I can see both approaches from each parent here, right? Beata's like, I know this treatment worked. I want to see my daughter get this. You're not giving it to her. Oh my gosh, let me just, we have to do this. And the father's more like, we need to play the game. We need to play the game, right? We need to go along with what they're saying. Both of them are a true reality. And so I can see the frustration of each parent. And this definitely led to major frustrations within the household.
There was a blow up.
They're going to hold this against you. Stop this bullshit now! I want to see my daughter again! Don't do this! Don't talk about pain meds! Don't talk about this and that! You're gonna cause more problems!
I mean, I can only imagine what that had to feel like for both of them, right? I mean, just the absolute frustration. It's so sad. And I can see where the mothers want to call and be like, did you give her this? Did you give her that? My daughter's in pain. And the father being like, quit saying pain meds, right? You know what I mean? Like, it's like, yes, we get it. She needs that. But anytime you do that, it's going to make the hospital say, why is she so concerned about this? But it was like she was leading with her heart, which, I mean, I get, right? So, anyways, let's keep going. So, here's the thing. So obviously with all this comes lots of court proceedings, right? Now, what they say is that when this begins, the first phase is called the shelter phase. So this is when they kind of lay out the cases with what everyone has said so far. Now, they say in this that it usually doesn't end well for the parents, and this obviously was the case with Maya's parents. Basically, it's like a he said, she said type thing. Well, who do you think they're going to listen to, right? You know, they going to listen to the parents that are being accused of this, or like a hospital saying, well, we heard this and we heard that. Again, once you get in this scenario, and this is, it should be this way, right? I'm not talking specifically towards this family, but in general, once these flags have been raised, well, everyone's thing is, well, we want to make sure that the child isn't harmed, right? We have to dot our I's and cross our T's. So they're going to always err in that way, and I get it. Again, we've seen so many cases where they don't do this, and it ends horrifyingly, right? Again, obviously in this one, the fact that evidence is suppressed and whatnot to show that this isn't, you know, what they're trying to make it out to be is a completely frustrating part of it. Anyways, I digress. Let's continue.
I think in light of the allegations, it is appropriate that a no contact order be issued at this time between mother and Maya. I know.
Yeah.
So now the noise that you heard, the scuffling, that was Beata collapsing in the courtroom at the hearing this. And I mean, again, I can just, it's like I can feel her disbelief. I can feel her frustration. I can't imagine going through that, having your child taken away like this from you, right? So Maya's put in child protective, custody at Johns Hopkins. Now, because they're saying, okay, well, mom's got Munchausen's, this is made up, they were lying, whatever. They're like, okay, well, we're not going to keep this regimen going on. But keep that in mind because we're going to see something else about that later down the road. But just know that they're like, oh no, this is made up. We're going to stop doing this treatment. We're going to quit doing this. They're like, obviously the mom has to start going for psych evals. Well, she does the evaluations and they're like, yeah, no, she doesn't have Munchausen's. She has a adjustment disorder due to her daughter being taken away. Understandably. And now for Beata, again, as you've seen already, she just does not get this. She doesn't get what she's going to have to do to get the daughter back, or if she gets it, she's not wanting to play the game because all she's thinking of is she's caring for her daughter who's in pain and they're not giving her the treatment that she knows she needs. And then also, I think that there's this level of just probably being just like, why are you doing this to me? And my daughter, right? Why are you doing this to our family? This is not how it's supposed to go.
Beata, this is the thing you need to understand about these cases. They're not fair. They don't care about evidence.
So one thing for this documentary when I was watching it that was very shocking to me is hearing what we just heard, right? These advocates and stuff talking about this in these clinical ways of they don't care about evidence, this is that, like once this bell has been rung, and you just, if you put yourself in those shoes and you're just like, oh my God. I mean, again, I talk about in these cases where, it's like a child goes missing or a loved one or whatever, especially a child. How do you ever fall back asleep again? You know what I'm saying? What are you doing this? Like, my God, we took her in to get helped and she's been taken away from us and they're trying to take her away from us, continually. I don't know how I'd react. So again, my heart breaks for all involved here.
That's why
Okay, I'm going to pause here and make this the part one. I think it's shocking how Child Protective Services is so willing to take children away on false allegations, but they're unwilling to look into real allegations. Like, look at Ruby and Kevin Frankie and how many years those children endured child abuse and how Kevin's still walking free. All right, this is part one. I'm gonna go eat some breakfast and then I'll come back and do part two.